On the 10th of March, a mainline business journal called the Business Insider, you can find it on the internet, it's easily available, well known, been around for years, carried a remarkable graphic. It was compiled of statistics from the Centers for Disease Control, which is a governmental agency based, if I'm not mistaken, in Atlanta, Georgia. And so the government statistics were what Business Insider worked with. They looked at 8 countries and they asked a simple question. As of the 8th of March, that was the latest date they had to work with, and this document is dated the 10th of March. As of the 8th of March, in each of these 8 countries, they had a statistic as to how many people had been tested for the coronavirus. The virus begins in December of 2019 in China, as best we know, and spreads from there. So we're talking now about the 8th of March. You've had all of 2020 and some weeks in 2019 for something to be done, either to prepare to test the population or to undertake the testing of a population. So let's look at the 8 countries and start with the most successful, South Korea. That's right. South Korea had tested, as of March 8th, roughly 3,000 out of every million people in the population. Out of every million in their population, they had tested 3,000. In China, a much, much larger country, they had tested 2,000, roughly, out of every million. A colossal achievement in a society that large. And then I would go through, if I had time, all the other countries, but I want to get to number 8, the one with the poorest record. It is the United States of America. And how many people had the United States tested as of March 8th per million? Ready? 5. Not 5,000, not 500, 5. South Korea, 3,000. The United States, 5. So when you hear, which you still can, that there haven't been that many confirmed cases of the coronavirus, the explanation for that is not that we don't have many people with the disease, it's that we haven't tested anybody. It's an astonishing reality. So what have we got? We have got a population that is certainly infected, given the travel from all over the world, China, Iran, Italy, to mention only the most important cases. The travel between those places and the United States is continuous and has been now for months. But there's no testing. The disease comes here in a variety of forms. It spreads. We don't know because there's no testing. What is going on here, therefore, is panic. The panic set in the first week of March as people began to realize that this disease, which has produced 4,000 or 5,000 dead people already, and 100,000 plus who have suffered and had the disease, hasn't even been understood in the United States, let alone dealt with. Nor is there any preparation for it. The reports are all over the United States of clinics and doctors and nurses who can't get the tests. The kits to do the tests are not available. The companies that could have and should have made them, by the way, there are companies all over the world that make these things. The World Health Organization has certified that the one made in Germany is the best one and is widely used as a result of that. So there's no problem with availability of the test. It's just that they haven't gotten them here to the United States to find out. So, of course, the disease is spreading. Since you don't even know who has it, your techniques for limiting the spread become crazy, overdone, gross, because you're trying to deal with something you can't quite pinpoint. Not because it's technically impossible, it isn't. Not because it's scientifically impossible, it isn't. So what is the problem here? And this is what I want to focus on more than anything else, because I don't want to repeat what you can get in the mass press, which I'm sure you've all seen. The problem here is a system that is not working. And by not working, I mean a system that doesn't protect the health and safety of the people, which is actually one of the most important fundamental obligations of any system. Let me explain. We can start with this problem of testing. Even if we had the kits, which we don't, even if we had the system set up to provide everybody with a test, which we don't, millions of Americans are working and living in a United States that gives them every incentive not to go and get tested, even if they're sick, even if they're coughing, even if they have a fever or any of the other signs of this virus. And let me go through them briefly with you. 30 million Americans have no health insurance. They're not going to go to a doctor. They have not gone to a doctor for years. They wait out their illnesses because they're not covered by an insurance and they can't afford what doctors charge to people without insurance. They're not going to go when they get a cough. They're going to wait it out. They're not going to go when they get a fever. They're going to wait it out. They've been doing that all their lives. And unless you made it colossally easy and colossally free, it's out of the question. Neither of those things have been done. And so those 30 million people are getting the disease and spreading it, and there's nothing at all being done. But that's the tip of the iceberg. Let's turn next to the 150 million that have some medical insurance from their job, typically. Well, most medical insurances have two things that work against going and getting a test. One is called a deductible, and the other one is called a copay. A deductible means that you have to pay the fees up to a certain amount, and then the insurance kicks in. Well, this is early in the year. People haven't used up their deductibles yet. So for them to go to a doctor now to get tested, that's going to cost them money out of their pocket, which they cannot afford. Then there's the copay. Even if you don't have the problem with the deductible, many insurances require the individual to kick in part of what the doctor's fee is. Those people have not gone to doctors when they've had a fever or a cough because they can't afford it. And that's what they're doing now. And that's what they've been doing for the last 2 months, giving this disease a chance to spread in ways we still cannot recognize or count or measure. But I'm still not done. We've got 10 million or more undocumented immigrants in the United States. They don't go to doctors because they're afraid that the record keeping of the doctor will find its way to the government, which will come and grab them and ship them back to wherever it is they came from. Those children in the cages that Mr. Trump is infamous for, what about them? No one knows, no one asks. So we have created an incentive in our crazy medical system for people to behave in a way that worsens this disease, doesn't solve it. But it's true on the supply side too, not just a demand for tests. Why aren't there any tests? Why didn't the United States bring over the German tests if they're the ones endorsed by the World Health Organization, which they have been, as the best, which they have been? Why have no American companies produced them? Why didn't the American government order these tests the minute they heard anything if not earlier, because these kinds of testing kits can find other diseases too. Why isn't there a stockpile that could immediately be made available? Why isn't it distributed in key places around the country so it's quickly available? What's the problem here? The kits are very small. They don't weigh anything. Gee, the government would have had to buy them from the companies that make them. And you know, if the government buys it, and they buy hundreds of millions, because that's how many people we have in America, 325 million, then of course the government gets a very good price because it buys in bulk. Those companies don't want that. They want the doctor over here, the nurse over there, the clinic over there to buy small quantities at a much higher price. And until they get it, and until there's a market, they're not going to produce them. Why? Because it's not profitable to produce something and have it sit on a shelf for a couple of years waiting. That's not privately profitable, but it is public health idea number one. Of course, you stock all the things you need to keep your people safe and healthy. Let me give you an example. The United States, at enormous expense, buys and stores in underground bunkers petroleum. Huge amounts, at an enormous expense. Why? Well, for the national security, in case the oil we need can't be brought in from outside, we have a... I see. To manage your oil supplies, you spend a lot of money to store the thing you need to be secure. But for the health, not so much. Not so much. What's this about? You have a private healthcare system. The private healthcare, the people who make the kits, who make the drugs, who make the hospitals, the clinics, they're private profit operations. They're looking to maximize the bottom line, as they will tell you if you ask. So the health and welfare of the American people is held hostage to the private profit system. If it isn't privately profitable, it doesn't get done. And now we see the result of such a system. Allowing the medical care of a society to be handled by people whose first goal is private profit is crazy. And that was always true, but now we're confronted with the life and death absurdity of having done it this way. Of course we need a national health service. China has a national health service. At the beginning of this coronavirus, people made criticisms of China. They could have acted further, and that may well be true. But boy, when they finally got around to it, they've done quite a job. Building hospitals in the Wuhan area where it started, putting whole areas into quarantine and really monitoring that. They've been able to bring the numbers dramatically down. And now it becomes clear that the United States waited much longer, did much less. That is a very serious issue, and it doesn't just affect the health. It's very important to understand that the failure to take a whole host of steps. The coronavirus isn't the only dangerous virus. A few years ago, we had the SARS virus. We've had the Ebola crisis. They are going to happen. We've known that for a long time. You have to be prepared. What possible excuse is there? What possible explanation for the lack of preparation, the lack of supplies, the lack of a distribution system to move the supplies from wherever they're stored to wherever they're needed? What in the world could explain this? And the answer is a private profit system that not only determines what the companies that make these things do, but has also infected the government, so the government doesn't want to spend the money. In recent years, the government, and not just under Mr. Trump, has cut back the budgets of FEMA, of the Centers for Disease Control, the other agencies that are supposed to do this, and they weren't adequately funded in the first place. So this is a critique of a system. Don't blame it all on the virus. Viruses are an old phenomenon. Medicine has studied them a long time. It is well known that it takes time to get a vaccine to deal with a virus. Therefore, you can't wait until the virus hits. So we need a vaccine. Stop. You needed to have everything in place to deal with this problem. There is no excuse, but there is an explanation. And the explanation, in a word, coming as a big surprise from someone like me, it's called capitalism. And letting capitalism govern your healthcare system produces the disaster we face in the United States, and other parts of the world do too. Let me turn finally to the economic impact. During the first 10 days of March, the stock market collapsed in large part in the United States, lost somewhere between 20 and 25% of its value. Trillions and trillions worth of wealth disappeared. Companies were wiped out, individuals were wiped out. The impact will take years to play itself out. We're just at the beginning. What's going on? Well, what's beginning to become clear to people is the scope of the risk. What do I mean? The coronavirus is so dangerous, and the unpreparedness of the United States makes the spread of it so enormous that all kinds of industries are basically shutting down. People are not going to movie theaters. They're hesitant to go to a restaurant. They're not taking airplanes or trains. They don't want to be where any one of the untested American population could cough on them or touch them or somehow pass bodily fluids to them, which contain the virus. So these businesses are drying up. And that has enormous consequences on those businesses. Let me give you just one idea, because it's going to be a theme this evening. This is a country, the United States, that has more indebtedness than ever before in its history. The government has record amounts of debt, By the way, I shouldn't have done what I just did. I understand I should go like this when I cough. That's one of the rules that's developing here in the United States. So, the government is in more debt than before. Corporations have greater amounts of debt, and even the mass of people have greater amounts of debt than they ever have before. Mortgage debt for the home they live in, automobile debt for the car they drive, the credit card with which they buy everything, and the student debt on top of that. Well, if the economy starts to go down, if the restaurants aren't full and the train tickets don't get sold and people are afraid to go to the supermarket, those enterprises not just lose revenue, but because we're indebted as a society, when they lose revenue, they can't pay their debts. They have to call the bank and say, we can't. We didn't raise enough money to pay the debt, let alone earn a profit for ourselves. The ramifications of this kind of breakdown in the economy, given our debt, means that our economy wasn't any better prepared for this virus than was the health system of the United States. And again, it's for the same reason. It's a profit-driven system. If it's profitable, well, then go borrow money from the bank and do it. Well, wait a minute. If something happens and the profit isn't made, you won't be able to pay back the bank. And there are many other examples. Companies sell shares of stock to people around the world and to businesses, premised on the notion that the company will pay dividends 4 times a year. You'll get a little check, your share of the dividends. That's your share of the profits. The coronavirus has taken away the profits. You're not going to get the dividends. The company is going to have to use that money to try to survive, not to pay it out to the shareholders. And for those of you who are not familiar with how capitalism works, the board of directors of a company If it earns some profits, are they required to distribute them in dividends? No. They can decide to do something else, and that's what they're going to do because their survival is now in question, just like the health of Americans is in question. So you're seeing what capitalism does, but you're also seeing what capitalism fails to do. It is a system with spectacular flaws that are now on display. Warren Buffett, one of the richest people in the world, is famous for a remark that he made about the stock market when it goes up and down, and in particular when it goes down. Here was his remark. When the tide goes out, that's when you learn which swimmer doesn't have a bathing suit. When this virus hits, you learn which system doesn't work. And we're learning, and you're learning, and the lesson may be extremely painful.